Chapter 32. Diseases of the blood. Did you cut your finger today? If so, you saw something that has fascinated scientists for years. That warm, red liquid we call blood is a most remarkable substance made up of many different things. For centuries doctors have been studying all these elements and how they work together in the body. The old saying, blood is thicker than water, is literally true. Human blood is 5 times thicker than water. That is why your blood has to be pumped under high pressure to be kept in circulation. The blood flowing in your veins and arteries is really a living tissue. A little less than half of it consists of red blood cells whose job it is to carry oxygen to the tissues. The red blood cells also remove the excess carbon dioxide from the system, as outlined on pages 51 and 234. Your bloodstream also contains white cells, several important groups of them. They are not nearly as numerous as the red cells, but they are highly important in a different way, for they protect you from harmful germs that would quickly destroy you. 2 types of these white cells, the leukocytes and monocytes, actually devour germs and destroy them. But in so doing, these white cells also die and form pus within an abscess or swelling under the surface of the skin. Some of your white cells die that you might live. Other white cells, such as the lymphocytes, also play an important part in maintaining your body's resistance against disease. They can change into other forms of cells to meet the needs of your body and keep you well. Still another group of white blood cells, known as eosinophils, are most numerous during allergic conditions. Somehow they help the body handle various toxic substances in the intestines. They are very numerous in the bloodstream of people who suffer from trichinosis, an infection that often follows the eating of poorly cooked pork, and also in schistosomiasis, a parasitic infection of the tropics. The basophils have a different function. They apparently liberate 276 diseases of the blood, heparin into the bloodstream, and thus prevent the blood from clotting. They are especially important in cases of prolonged inflammation. All these various cells make up about 40% of the blood. The other 60% of the blood is known as plasma, the liquid part of the blood. The plasma contains many different types of proteins, such as albumin, globulin, fibrinogen. It also contains many other important chemicals, including various salts and food elements, such as glucose that provides energy and fuel for all the cells. Thus we see that blood is not a simple liquid but a very complex substance. All these different elements must be kept in constant balance so that the body will have whatever materials it needs in just the right amount at the right time to keep you well. Anemia. About 5.5 quarts of blood circulate through the veins, arteries, and organs of your body. This rich red stream is kept in constant circulation by your heart. When things are going well you hardly think about this. But there are times when the blood volume may be so altered that the number of red cells in your circulation drops down a long way below the normal 5 million per cubic millimeter of blood. This is the serious condition known as anemia. There are several ways in which this may happen. For instance, a hemorrhage. A person whose blood level has been normal may suddenly lose a lot of blood because of a serious accident or illness. The body seeks to replace this sudden loss by pouring in more fluid or plasma. But the red cells are not so easily replaced. The victim may have enough fluid in circulation, but the red cell count may be so low that he feels weak and worn out on the slightest effort. This is the typical picture of anemia following a rapid loss of blood. However, slow bleeding from an ulcer in the stomach or intestine may also produce varying degrees of anemia. If the red blood cells are lost more rapidly than the body can replace them, the patient will naturally begin to feel the effects of anemia. A slow, steady loss of red blood cells through the urinary tract will do the same thing. Anemia also occurs from heavy menstrual bleeding. And the woman will feel tired and weak from lack of blood. In some cases, such as in hemolytic anemia, the blood cells are too fragile. They seem to be sensitized in some way, so that large. Anemia 277. Numbers of them are destroyed in the spleen. In malaria, parasites attack the red cell, feed on the substance of the cell, and later divide into 8 or 16 new organisms that in turn invade other red cells. Certain metals, such as lead, arsenic, silver, may also destroy red cells. For some patients, the same is true of quinine and certain other drugs. In other types of anemia, the red cells are not properly formed. Instead of being round and flat like a plate, they may be roughly spherical or irregular. They may then cause trouble in the spleen, and ulcers may develop in the legs, along with changes in the bones. In some rare types of anemia, the hemoglobin itself is not properly formed, so it cannot carry out its normal functions. Such cases are very difficult to treat. Sickle cell anemia is a major problem to some people of African descent. In this disease, the red cells assume the shape of a sickle, and this tends to hinder their passage through the capillaries. Not only do these patients have severe anemia, but there are times when they may also have jaundice and pain in the joints. Unfortunately, we still have no good home treatment for a severe case of sickle cell anemia. During an acute crisis, such cases are best treated in hospital. Cortisone may help in some cases for a while, but the outlook is not good. Sickle cell patients should not go up into high altitudes, because the lowered oxygen in the atmosphere may bring on a severe attack. Pernicious anemia. In this form of anemia, the blood cells are larger than normal, but fewer in number. Instead of 5 million red cells per cubic millimeter, the count may drop to 1 million. Trouble arises because the intrinsic factor normally produced by the stomach is not present to promote the absorption of vitamin B12 from the intestine. This disease was once very serious, but not today. Frequent injections of vitamin B12 will usually restore these patients to somewhere near normal. Iron deficiency anemia. Sometimes the level of iron in the body may be lowered, owing to chronic blood loss, as mentioned on previous pages, or more probably to a poor diet. Iron may also be lost from the body because of chronic diarrhea and other conditions such as sprue. See pages 344 and 349. Any patient with a severe hookworm infection will also have some anemia. Iron may not be properly absorbed because the stomach is not producing sufficient hydrochloric acid. Sometimes this occurs during 278 diseases of the blood. Pregnancy. Unfortunately, it not only affects the mother but also the baby. Severe iron deficiency anemia is seen in babies who are kept on a milk diet too long. Iron is also lost through excessive menstrual bleeding. This is often the reason why some younger women are weak and tired. The patient usually complains of weakness, easy fatigue, and irritability. Other symptoms include heartburn, flatulence, vague abdominal pains, soreness in the mouth, numbness and tingling in the extremities, and palpitation of the heart. The skin and mucous membranes are pale, the nails are often brittle, and there are fissures or sores at the corners of the mouth. In this form of anemia, the red cells are smaller than usual and often irregularly shaped. The treatment for this condition includes a correction of the diet by foods containing iron, as suggested on page 52. The patient should also be given some simple iron preparation, such as a tablet of ferrous sulfate twice daily. Bleeding ulcer should be treated or removed by surgery. Excessive loss of blood through menstruation can now. Bone marrow anemia 279. Be controlled by suitable medications, but these can be given only under the direction of your doctor. Bone marrow anemia. Many different factors may interfere with the normal production of red cells in the bone marrow. Infections, inflammatory conditions, rheumatoid arthritis, tumors of various kinds, cancer of the bones, and certain toxic substances, all of these may contribute to bone marrow failure. X-rays, atomic explosions, and radioactive substances may also be added to the list. They are likely to become more common. In bone marrow anemia, the patient feels tired, his skin is pale and waxy in appearance. He may have hemorrhages under the mucous membranes around the eyes. His blood count may drop below 2 million, and his white blood count may also drop from a normal of 7,000 per cubic millimeter to less than 1,000. In treating such a condition, the cause must always be determined. The patient should avoid any medication to which he is allergic. Blood transfusions are often needed in these cases. Vitamin B12 injections may help to restore the normal activity of the bone marrow, provided it 280 diseases of the blood has not been damaged beyond repair by radioactive substances, such as from an atomic bomb. Doctors are now attempting to transplant bone marrow from one person to another in the hope of solving this serious condition, should we ever be faced with real atomic war. Polycythemia. True polycythemia is slowly progressive disease in which there are too many red cells, so that the blood becomes dark and rather thick. The red blood count often rises from the normal 5 million to over 10 million per cubic millimeter. The true cause is unknown. Usually the patient complains of headache, weakness, dizziness, abdominal pains, and other distressing symptoms. Strokes are fairly common, and massive bleeding in the stomach may occur. The skin appears dusky and blue, cyanotic, particularly in cold weather. Some patients with polycythemia also suffer from gout. Polycythemia sometimes occurs in congenital heart disease and also in chronic diseases of the lungs. The best treatment is phlebotomy, in which some of the blood is drawn off at fairly frequent intervals. The patient must also be carefully watched for serious complications. A newer method is radioactive phosphorus, P32, available only at larger medical centers. Though there is still no cure for true polycythemia, most patients can live a rather normal life if the excess blood is removed frequently. Bleeding diseases. Purpura is a bleeding disease in which the walls of the smaller blood vessels become dilated and thin and then rupture, causing local hemorrhage. Purpura is more common in women. It tends to come on in middle life and also to run in families. In one type of purpura there may be pains in the abdomen and joints, as well as some kidney disease. The best treatment is to try to stop the hemorrhage by local pressure wherever possible. Applications of ice over the affected areas may help. Hemophilia is a hereditary disease which usually occurs in young males whose mothers have had the disease in their own family. The mother transmits the disease, but does not suffer from it herself. Her father and brothers may have had the condition. The disease is due to a deficiency of a certain type of globulin. This results in bleeding into the joints and soft tissues, even after some slight injury. Leukemia and its treatment 281. Or surgical procedure. There may also be blood in the urine for no apparent reason. Treatment is directed at keeping the child free from injury as far as possible. Transfusions of fresh, whole blood or plasma should be given when bleeding occurs. Local applications of fibrin are also of value over the bleeding area. Dental extractions are a real problem, but these can be carried out provided blood is available for transfusion, should be needed. Leukemia. Leukemia is a serious disorder of the blood-forming tissues, the cause of which is still unknown. It may be due to some virus. At least this has been demonstrated in mice, but not yet in man. Leukemia is a type of cancer of the blood-forming organs. It may follow excessive exposure to X-rays and certain chemicals, particularly those related to the benzene group. There are a number of different varieties of leukemia. Fortunately, none of these are common compared with other diseases. Patients with leukemia produce an excessive number of white blood cells. They may be either granulocytes, lymphocytes, or monocytes. Leukemia is usually more common in males. The patient tends to complain of weakness, fatigue, lack of appetite, and weight loss. He has some anemia of loss of red blood cells due to the bone marrow being overcrowded with white blood cells. The spleen is usually large and tender. There may be pain in the bones and hemorrhages in the skin in various parts of the body. The white blood count may rise from the normal 7,000 to 25,000 or even 50,000. In some cases it may rise to over 200,000. The outcome depends largely on the type of leukemia. Many leukemia patients are living longer today, thanks to new methods of treatment, but still the outlook is not bright. Treatment: anything that will lower the white blood count will usually help. X-ray treatments over the spleen, bones, lymph nodes, and other issues are often effective. Radioactive phosphorus, P32, may also be tried. Certain drugs may help to depress the overactive bone marrow, but these must be prescribed on an individual basis. Prednisolone may help to control the bleeding in the later stages. In chronic lymphocytic leukemia, the disease often con. 282 diseases of the blood. Continues for years. It is rather benign, and treatment may cause all evidence of the disease to disappear for long periods of time. Blood transfusions are sometimes needed when the blood count drops too low. In the more acute cases, death may occur within a few months after the onset of the disease. Someday we may have a more effective means of therapy. Hodgkin's disease. Hodgkin's disease is a chronic condition, the cause of which is still unknown. Swellings in the lymph nodes along the sides of the neck or under the armpits may be the first indication of trouble. Usually there is no pain. In some cases the spleen and liver will be enlarged and tender. During later stages there is often a high fever and a peculiar bronze pigmentation of the skin. These patients also tend to suffer from herpes zoster, or shingles. The diagnosis is difficult in the earlier stages. Unfortunately, we have no cure as yet, but X-ray therapy may help to shrink down the enlarged lymph nodes and make the patient more comfortable. Good general nursing care, providing a balanced diet of proteins and vitamins, and avoiding excessive fatigue and respiratory infections is still the best mode of treatment. Blood poisoning 283. Lymphosarcoma. Lymphosarcoma is another malignant disease affecting the lymphoid tissues and lymph nodes. It is similar to leukemia and in some respects also resembles Hodgkin's disease, especially in children. Enlarged lymph nodes like lumps may be seen and felt on the side of the neck. One of these should be removed by surgery and studied by a pathologist. If lymphosarcoma is found, the other enlarged nodes should be removed and the whole area treated with X-ray therapy. ACTH and cortisone often bring relief to those who are seriously ill with this disease. When the disease is widespread, the outlook is not good, but each new discovery of medical science is bringing us nearer the day when all such diseases can finally be brought under control. Septicemia. Blood poisoning, or septicemia, is a most serious condition in which toxic or poisonous materials find their way directly into the bloodstream, and by this means the poisons are spread to all parts of the body. The human body has strong defense barriers against inflammatory disease. These include the skin, subcutaneous tissues, white blood cells, and antibodies. When these are overwhelmed by some serious infection, the toxic materials are absorbed directly into the bloodstream, causing localized inflammation, or cellulitis, in other parts of the body, such as the lower extremities and pelvic areas. The spread of infection may be rapid, especially if there is some injury or weakness in the body, or if the patient is in a run-down condition. Usually there is a fever with chills, weakness, and headache. The local area may be red, swollen, painful, and hot. Keep the patient in red and apply hot moist dressings over the inflamed area. Antibiotics, such as penicillin, sulfa, or tetracycline, are advisable. These should be given in large doses until the patient is entirely well. Lymphadenitis means an inflammation of the lymph nodes in some part of the body, the most frequent places being in the groins and under the arms. Apply not moist packs to the inflamed areas 2 or 3 times a day. In more severe cases, penicillin should be given, the usual dose being 600,000 units